Okay, let's think about this for a second. Managing something like diabetes, it's constant, right?
Yeah.
Nearly 500 million people worldwide deal with it daily.
Mm-hmm.
Medication, monitoring.
It's overwhelming for so many.
Exactly. So what if there was like a wearable device designed specifically to make sticking to treatment easier? That's the challenge we're going to unpack today.
Yeah, and it's a really interesting way to look at problem solving. Our source material for this deep dive is, well, it's a bit different. We've got parts of a discussion where someone's actually mapping out how they'd build this kind of wearable.
Oh, interesting. So we get to see the thought process.
Pretty much. A structured approach to a really complex, real-world problem. It's quite insightful.
Okay, got it. So our mission here is to sort of pull apart the key things you need to consider when designing something to help people stick to their medication plans. We'll look at this candidate's thinking, the questions they asked, the problems they saw, the features they proposed.
It's like a mini case study in user-centric design, really.
Right, so where did they even begin?
Well, what's quite telling is they started right at the beginning asking for clarity. Like, could you also please let me know what we are trying to achieve with this product?
Good question.
Yeah, and they proposed it's about making medicine delivery easier, improving patients' lives, that focus right from the start on the user experience. That's a really solid foundation.
Absolutely, and they zeroed in on diabetes pretty quickly. You mentioned the scale, but they also highlighted the constant management it requires.
They even called it the new cancer in terms of that ongoing care burden. It really emphasizes the persistence of the challenge.
And setting that age range, 20 to 60 years old, that gives some focus too, right, for the design.
Definitely. It helps define the initial scope. Then, interestingly, they looked at what's already out there.
The existing solutions.
Yeah. You know, the standard pill boxes, which are clunky and no good for injections, obviously. Phone reminders. People just swipe them away.
Yeah, easily missed.
And even the wearables that exist now, they pointed out, often don't have that integrated approach. You know, linking glucose levels with diet information.
Ah, I see. So there's a gap.
Exactly. That gap analysis is crucial. Where can a new thing actually make a difference?
And they brought up cost effectiveness early on, didn't they? Thinking about lower income countries where diabetes is very prevalent.
Yes, and that's so important. Thinking about accessibility right from the outset. It's not just a nice to have, it's a core design constraint if you want broad impact.
Okay, so they've defined the goal, the target group,
Yeah.
looked at the competition. What next? The actual problems people face.
Precisely. They moved on to pinpointing the real difficulties for people managing diabetes day to day, and this is where you see the empathy kicking in.
Like what specifically?
Well, number one, just plain forgetfulness. Busy schedules, maybe some cognitive decline in older patients.
Sure, happens to everyone.
Then there's the complexity of the regimens themselves. Multiple medications, different times.
It can be a lot to juggle.
Definitely. And anxieties too, fear of needles for injections or worries about side effects. Plus, just maintaining motivation, understanding why sticking to the plan long term is so vital.
Those are serious hurdles.
They really are. And the candidate explicitly linked these back to why current solutions fall short. Pillboxes don't help with injections or reminders. Phone alerts don't combat deep-seated forgetfulness.
And the lack of integrated data in current wearables means you don't get that full picture for management.
Exactly. It's a very clear articulation of the unmet needs. This is the foundation for building something genuinely useful.
Okay, so understanding the general problems is one thing, but people are different, right?
Right. And that's where the next step they took becomes really valuable, creating user personas.
Ah, personas, like specific examples of potential users.
Exactly. They sketched out 3 distinct types: the busy working parent, the cost-conscious diabetic, and the senior diabetic.
Okay, tell me about them. The busy working parent.
So, think about someone juggling work, kids, maybe aging parents, finding time for healthy meals, exercise, remembering medication doses. It's a constant struggle.
I can imagine. So what do they need?
Things that slot into their chaotic life. Integration with meal planning apps, maybe? Automated reminders you can customize? Maybe even some gamification or social support features to keep them motivated?
Okay, that makes sense. What about the cost-conscious diabetic?
Here, the biggest barrier is affordability. Not just the device itself, but access to healthy food, maybe even the medications.
Right, so their needs are different.
Very different. They need an affordable device, maybe focused on the essentials, reliable glucose monitoring, basic reminders. Crucially, maybe integration with free community resources, support groups, perhaps even partnerships with pharmacies or insurers to bring the cost down.
Accessibility again. And the third one, the senior diabetic.
Yeah, here the challenges might be more around tech savviness, perhaps memory issues becoming more pronounced, managing complex schedules.
So simplicity is key.
Absolutely paramount. An easy-to-use interface, maybe a large display, voice-activated reminders could be huge, and definitely integration with their doctors or healthcare providers for easier monitoring and support.
Wow, those personas really highlight the different angles.
They do, and what's clever is how the candidate used them. They looked at all these varied challenges and kind of boiled them down. They concluded that the biggest cross-cutting issues were forgetfulness and the sheer complexity of managing the meds.
So those became the main targets for this solution.
That's the idea. That synthesis directly guides what features you start thinking about.
Okay, so let's get into the features. What did they propose?
Well, top of the list was integrated glucose monitoring. The vision was for something painless, real-time.
Continuous monitoring.
Ideally, yeah. Something that allows for personalized adjustments to medication based on current data. That's a big step up from finger pricks.
Huge convenience factor and potentially much better control.
Exactly. Then, building on that, meal logging and reminders. Think integration with nutrition apps, making it easy to track what you eat.
And linking that to the glucose data.
Yes, and providing personalized suggestions, maybe even alerts about food-medication interactions, tackling both diet and meds together.
That sounds powerful. What else?
The vision was pretty comprehensive. Activity tracking was in there too, personalized goals, progress tracking, maybe gamified elements to encourage movement,
Makes sense. Exercise is crucial too.
and also educational resources and coaching, delivering personalized info, motivational messages right through the device or an associated app.
Trying to address that motivation and understanding gap we talked about earlier.
Right. And finally, even social support integration, connecting users with online communities, formal support groups, or even directly looping in their healthcare team.
So it's not just a sensor, it's aiming to be a whole support system.
That seems to be the goal. What's really insightful is how clearly you can map each proposed feature back to those initial pain points and the needs identified through the personas.
It's very user-focused.
Definitely. But they also acknowledged, quite rightly, that features alone aren't enough. You have to think about the physical device, the software.
The practicalities.
Yeah.
Like what do they consider for the hardware?
Things like comfort, you're wearing it all the time. Discreetness, people might not want it to scream medical device. Water resistance, obviously.
Well,
Battery life is always a big one for wearables.
and making sure those sensors, especially the glucose one, are actually integrated seamlessly and accurately.
Absolutely critical. And on the software side,
User interface has to be simple, right? Especially thinking about the senior persona.
non-negotiable. And data security, we're talking sensitive health information here. So adherence to regulations like HIPAA is essential. Privacy is paramount.
And making it play nice with other health apps. Interoperability.
Yeah, that helps create a more connected, holistic experience for the user, not just another isolated data silo.
They also mentioned scalability and sustainability. What did that involve?
Thinking beyond just launching the product, how do you get it to the people who need it? This means thinking about partnerships with diabetes organizations, with doctors and clinics, maybe with insurance companies to cover the cost.
Building an ecosystem, not just a gadget.
Exactly. It's about ensuring long-term viability and reach.
Okay, so that's a lot of potential features and considerations. How did they decide what to focus on first? You can't build everything at once.
No, you definitely can't. This led them to a prioritization framework, basically a structured way to weigh things up.
How did that work?
They used a matrix, looking at each feature through 3 lenses. Impact, how much difference will it make for the user? Feasibility, how hard is it to actually build? And urgency, how critical is this need right now?
Okay, a classic approach. How do the features stack up? Let's take integrated glucose monitoring.
Right. Impact, high. Direct effect on managing blood sugar and adjusting meds. Feasibility, medium high. It's technically challenging to do well, continuously and painlessly. Urgency, high, especially for people with volatile glucose levels.
Seems reasonable. What about meal logging and reminders?
Impact, medium high, because diet is so fundamental. Feasibility, high. The tech for logging and reminders is pretty mature. Urgency, medium high, particularly if users don't have good reminder systems already.
Activity tracking.
Impact, medium, good for overall health, maybe less direct impact on immediate medication adherence compared to glucose or meals. Feasibility, high. Lots of wearables do this well. Urgency, Medium kind of depends on the individual user's needs and current activity.
Yeah, the educational stuff. Coaching.
Impact. Medium, feasibility. High delivering digital content is straightforward. Urgency. Medium, again, depends on the user's knowledge gaps.
Lastly, social support.
Impact. Medium, maybe more long-term benefit. Feasibility. Medium depends on setting up the infrastructure, partnerships. Urgency. Medium, unless someone is really isolated, then it could be higher for them.
Okay, so after running through that matrix, what emerged as the top priorities?
Based purely on those ratings, integrated glucose monitoring and the meal logging reminders came out on top. High impact, relatively high urgency.
But it's not just about the numbers, right?
Exactly. The candidate was smart to point out the final decision isn't purely mechanical. You have to consider, who's our initial target user? Are we focusing on the tech-savvy parent or the senior first? What resources, time, money, engineers do we actually have?
And what are competitors already doing?
Right. What's the competitive landscape? Maybe someone else already does basic reminders really well, so integrated glucose is the bigger differentiator. It's a strategic choice based on multiple factors.
A nuanced decision.
Yeah.
You need that deep user understanding, a realistic view of your own capabilities, and market awareness.
Absolutely. And then, assuming you build something, how do you know if it's actually working? If it's successful?
The metrics, measurement, what do they suggest?
They proposed very practical, measurable indicators focused on user behavior and ideally health outcomes.
Right.
Like what percentage of users are actually using the glucose monitoring? How often are they checking their levels via the device?
Okay, basic engagement.
Yeah. And crucially, how quickly do people respond to alerts, like a low or high glucose warning? That speaks directly to safety and effectiveness.
Good point. What about the diet side?
Tracking how many users log meals, maybe the completeness of the information they provide. Are they just logging snacks or full meals?
And are they following the advice?
That's another metric. Adherence to the personalized meal suggestions. And tying it back to a core problem, are the meal-related reminders actually reducing the number of missed medication doses?
So metrics that directly link back to the original goals of improving adherence and management.
Exactly, closing the loop.
Okay, so wrapping this up, looking back at this whole hypothetical design process, what are the really big takeaways for you?
For me, it's got to be starting with the user. That deep dive into their needs, their pain points, using things like personas to really build empathy. You can't design effectively in a vacuum.
Yeah, that user centricity came through really strongly. And the iterative nature of it, understanding the problem, proposing solutions, evaluating them.
Right. It's not just about having clever ideas for features. It's about rigorously connecting those features back to the core problems you identified.
And the need for strategic thinking, too. The prioritization, considering resources, the market, and crucially, planning how you'll measure success from the outset.
Definitely. It's a really disciplined approach. And even though this was, a hypothetical candidate discussion, the framework itself, that way of thinking, is incredibly valuable. It applies way beyond just medical devices.
Absolutely. It's a solid model for tackling complex problems in almost any field where you're trying to create something useful for people.
Which brings me to a final thought, maybe for our listeners to mull over. We've talked a lot about these design principles, user focus, data, prioritization. Well, thinking about those principles, what other everyday problems or frustrations out there seem ripe for this kind of approach? Where are those overlooked needs that maybe technology designed thoughtfully could actually address?
Interesting question. What else could benefit from this level of user-focused design? Something to think about.